Hello, this is going to be my informative speech. I'm going to be doing it over scoliosis. Did you know 4 out of 100 people are diagnosed with scoliosis? With that being said, even famous people you may know have scoliosis. Scoliosis is an abnormal curve in your spine. Causes of scoliosis is identified as neuromuscular or idiopathic or cognitive. Idiopathic scoliosis is diagnosed where all other causes are excluded and comprised about 80% of all cases and is usually diagnosed before puberty. Neuromuscular scoliosis is scoliosis that is secondary to the neurological or muscular disease. Cognitive scoliosis result from embryonical metaphor of one or more of the vertebrae. Comorbidities is their cerebral palsy, spinal cord trauma, muscular dystrophy, spinal muscle atrophy, and spinal bifida. Signs and symptoms. Shoulders could be uneven. One or both hips are raised. Head is not centered with the pelvis. Rib cage could be at different heights. Entire body leans to one side. Back pain, and 23% of patients with idiopathic scoliosis presented with back pain at the time of internal diagnosis. Complications. Scoliosis may cause the rib cage to press against the lungs and the heart, causing lung and heart damage. As children with scoliosis go into adulthood, they are likely to have chronic back pain. This disease can lead to feeling of conscience. The diagnosis for scoliosis can be identified through a physical exam, an X-ray, or an MRI, or a CT. Schools and doctors use the Adams forward test, which is where they have you bend over and touch your toes, and they see if your back is in line. The primary age onset for scoliosis is 10 to 15 years old. A curve is considered significant at the greater than 25 or 30 degrees. I have some pictures here. If you can see them, see how the back is like curved. So this is from lowest to highest severe and what it could look like from looking at somebody. Treatments. Options for scoliosis include bracing, surgery, or observation. Braces are used with patients that are still growing. It is not recommended to perform surgery when the curve in the spine is greater than 40 degrees and there is progression. Exercising can promote overall well-being for those with this disorder. In children with some scoliosis, it is recommended they are examined every 4 to 6 months, and for adults, they should get x-rays once every 5 years. Prognosis. Scoliosis does not stop one from being a joyful life. Most patients with scoliosis are able to lead functional and production lives, with 9 out of 10 patients displaying normal cardio and functioning. With mild scoliosis, the progression is positive, and most individuals with the condition do not require specific treatment. Patients with very severe scoliosis are more susceptible to lung infections and pneumonia. Prevalence, and it affects 2 to 3% of population, or the estimated 6 to 9 million people in the United States. Occurs equally among both genders. Females are 8 times more likely to require treatment. Every year, 30,000 children are fitted with a brace, and 38,000 patients undergo spinal fusion surgery. People you may know that have scoliosis. There is a famous runner. His name is Usain Bolt. And we also have General Douglas MacArthur. Questions? What are the 2 symptoms of scoliosis? Shoulders are uneven, head is not centered directly above the pelvis, one or both the hips are raised, waist is uneven, rib cage are at different heights, entire body leans to one side. Question number 2, how does this become diagnosed with scoliosis? Physical exam and x-rays and CTs are performed. What is the treatment options for scoliosis? Bracing, surgery, and observation. Name a comorbidity of scoliosis. Cerebral palsy, spinal cord trauma, muscular dystrophy, spinal muscle atrophy, and spinal bifida. Which age groups is most likely to develop scoliosis? 10 to 15-year-olds will be your answer for that one. References that I used was scoliosis, retrieved January 28th of 2020 from www.aans.org. Patients, neurological conditions, scoliosis 2019, June 22nd, retrieved January 29th of 2020 from www.macolimmer.org. Disease condition, and Smith Y 2018, August 23rd, scoliosis progression. Thank you.